What's up, Duck Riley? How are you?
What's up, Princess Robertson?
It's still so hard not to get that Cooper in there, isn't
No, yeah, especially for me.
it? Everybody else too. Especially at church, it's still hard for everybody to get that one right, but it's okay. It's okay. I told him I wanted my own name anyway.
I
Let me
hear
see.
that. And
Let me.
all I know is, I didn't know if I was going to be able to get on in time until West Virginia just started killing Troy. But anyway,
Uh huh. Uh huh. Let me see. We have Darrioun in the studio. How are you, sir? Doing good. Hold on right there. I think we have Vaughn in the studio. How are you?
How's everyone doing this evening?
We're doing good,
how
Vaughn.
about how about them how about them Mountaineers?
Oh Lord, have mercy.
Yes, let's go, Mountaineers. How do you feel about that, Dr. Webb and Princess? Dr. Webb is both a Marshall Hurd and West Virginia Mountaineer.
Yeah, I may not be keeping up, but I'm always happy to hear them winning.
Uh huh. See, I'm just outnumbered. I really am outnumbered with this. So, Duck, they beat Troy today. Troy is formidable. They tore up Florida Gators.
Yeah, they right now they're up 12-0.
Okay, yeah, that's probably a done deal. Troy's getting ready for tomorrow because I don't think they have a loss, right?
Yeah, they lost to West Virginia the very first game.
So this eliminates. Wow, Duck. Does this put you all
Yeah,
in the finals?
yeah. No, they have to play North Carolina again.
Okay. Okay. All right. Wow. Amen, Duck. A little bittersweet that it's not the Gators, but okay, if it's a Mountaineer, I'm still honorary, right, Duck? Or is the verdict still out on that?
No, I got to talk to Dr. Webb and Vaughn about that. I don't know if we're gonna pull you in yet. We got to check your credentials.
Well, if you're not a Gator, you're Gator bait. So go ahead, you guys get started. Do you want to start now, Duck? Because
Oh
I'll
yeah,
be.
yeah. I'm gonna just initiate the conversation. Then hopefully Tim will be in here. But Vaughn got it. I'm telling you, Princess. I told Vaughn today she does such a great job. She needs her own show.
You say that every time we do this,
He
but I'm
Yeah.
glad
does. He
our sports
does.
our sports platform does informational shows like this. I learned so much. So go ahead, Duck, and pass the torch to Vaughn, and then we'll get Dr. Webb in here.
Okay. Dr. Webb, just for the listeners and stuff, just kind of tell us a little bit about yourself, where you're from, that type of deal.
Okay, yeah. So before I start talking, I've got Starlink, and so sometimes it may go in and out. I don't know. But anyway, um, my name is Dr. Darrioun Webb. I'm a licensed clinical psychologist in the state of West Virginia. I'm actually the 1,370th. So there aren't a whole lot of us in the state. I was raised in Bluefield, though. So I grew up with a lot of our family, Vaughn's cousin. So a lot of presence of our family, and then watching her generation age. But
Thank you.
yeah,
Throw
that's
that
just
in
the
there.
sort of the natural flow of things, right? Watching people age, living with my grandma. It's where I'm going with that. Being raised in my grandma's house, watching them age and seeing a very interesting lens of human lifespan. So I've always been interested in people. So when I got to college, I had sort of been struggling with what to study and ended up studying psychology, and has been fascinated with it ever since.
Okay. What colleges did you attend? For the listeners, I know because Vaughn and I talked earlier, but people that are listening in would probably like to know.
Yeah, so I went to Marshall University for the first half of undergrad, and then I transferred to WVU to complete my degree with my friends. So I got my bachelor's from WVU in 2017, and then I got into Marshall's graduate program for psychology, and from 2018 to 2023 when I finished my degree.
Yeah, you brought up something interesting. You didn't know uh, what you were going to major in, and then what made you fall in love with what you're doing now?
So there's a lot of factors here. I started off just pursuing what I was interested in at the time. You know, at 18, you really don't know what you want to do with the rest of your life. But for a while, I've been convinced, okay, I'm going to do fashion design. And so I'm studying basically business. And then I realized I can't draw. And business for me isn't really all that interesting. I don't really want to be an entrepreneur. So I sat and thought to myself, what do I want to do? And the only thing I could think of was, okay, I've got a cousin who's involved in psychiatry. She's successful, and when I thought about mental health, I think part of it as is common among psychologists. There's something wrong with us, and we want to figure out why. And so we study psychology to help other people, but we also kind of do it to understand ourselves. So there was this mix of had plenty of experiences growing up in school where I'd have these kids, other youth, other peers, kind of confiding in me often. So I found myself as one of those people that people kind of gravitate towards to talk about their problems. And so it felt natural to kind of entertain a career in psychology.
Okay, Vaughn.
Okay, yeah. So as we know, your drive like yours doesn't happen in a vacuum, Dr. Webb. So your cousin, as you mentioned before, Dr. Patrice Harris made history as the first African American female president of the American Medical Association. And how did her path influence your own ambition, and what kind of conversations did you two have about shifting the landscape of healthcare? Now, you mentioned that you watched, sat back and watched her, and she was doing well with that. And one of the things I've heard Dr. Patrice Harris say is that it's not a big deal, which it is a big deal that she is the first in anything, but a bigger deal is to make sure she's not the last. So, Darrioun, do you feel like you would carry that same banner, like mentoring other
Yeah.
young Black males to enter your field of psychology?
Absolutely. So, like to start off with, watching her from afar, I didn't know a whole lot about what psychiatry was. So, really, it was a focus on, this. She seems to be very successful, and as far as I can tell, well respected, and is enjoying her career. And I was looking for something else, something for myself, and not having many other role models that I actually like knew in real life. That was a lot of my focus. So, in talking with her briefly at the time, it was a long time ago. I can hardly remember the conversation, but I did get the sense that it was like an enjoyable career, satisfying. Um, and so to talk about like making sure that you're not the last, I would love to focus on kind of facilitating more Black men in mental health anyway, because yeah, it's great to be the first. And it took till 2023. I think the program was only 20 years old though. So it's also Marshall's program is quite young. And so I think there's a lot of opportunity to bring more Black men through the program. And as far as looking at the profession, clinical psychology, while it is psychology typically is female dominated, once you get to the doctorate level, it becomes a more male dominated field. I don't have the numbers off the top of my head, like statistically, but I also am under the impression that about maybe 5% of doctorate level psychologists are Black men. So it's important to me to get that number up, and I would like to work with the university. I haven't been in contact with them a whole bunch, but I'd like to work more with the university in the future on mentorship and helping kind of make that happen.
Excellent, excellent. My husband will often quote some philosopher saying that most of us live quiet lives of desperation. So, we have people in our lives every day, coworkers, family members, strangers who are literally dying on the inside, suffering in silence because of mental health and not addressing that, or maybe not even identifying, you know, negative thoughts or not. getting out of the bed or having high highs or low lows as a mental health issue. Can you give us some insight on how we can identify, even how ADHD often interrupts our lives? How we can identify that and being honest with ourselves about going to your general practitioner for some diagnosis.
Yeah. So, if you're trying to identify many sort of mental health related impacts in your life, I often will frame it as, hey, look at sleep, diet, exercise. If you don't keep up with anything, see, am I sleeping well? If I'm not, has it been an increase, a decrease? Um, if I'm same with eating, has my eating changed? Has it been a significant increase or decrease? And same with exercise or activity level. Am I suddenly more active or less active? Those give you three very simple markers to look at, as well as thinking about functional impairment. Is my work or occupational functioning, is it impaired in any way? Am I having trouble concentrating at work? Am I moving more slowly and getting more negative feedback from supervisors and peers? Same thing with social functioning. Have I decided to withdraw, or am I being incredibly risky with my social behavior? Am I getting into fights, things like that? Um, and also just with myself, how am I talking to myself? My mood up or down? So you can look at it from these dynamics or across these continuums. What factors in my life are important, and am I seeing significant increases or decreases in any of their quality or quantity? That can be just a nice surface level space to look. And um, if you need to, or not just if, but like this, we do want to be mindful of our stigma about mental health.
Hmm.
We often, and I think we're seeing some changes in stigma in mental health. That's why we see all these numbers increasing. Um, but having stigma about mental health, it's unhelpful because it's better to just check in and see what a professional would think. Do I have anxiety? Do I have depression or anything else going on? Just getting the opinion of a professional. They probably will be happy to tell you that nothing's going on, or if something is going on, start getting treatment. So I think that if we can do everything we can to kind of reduce stigma, then it's just sort of a net benefit.
I like that. I like that. Who do you think, what population or what group of people will be the least diagnosed or the first to ignore signs of depression or anxiety? And they often go hand in hand.
That's a really good question. I actually wish I had my current DSM in front of me. It's at the office. But you will see variations in this depending on the diagnosis. So, like, I don't want to say anything wrong, so I'm not going to get too specific. But for anxiety or for depression or for PTSD, for any disorder, you're going to see different rates amongst both gender and race. So you'll see higher incidence for Black men or women. For just using this as an example, not the actual number, but for like OCD, right? You might see higher incidence rates in one demographic group, and you might see like Hispanic or Latino um, communities are not very much involved in monitoring another specific diagnosis. So when you think about underserved groups, there is a lot of variation with amongst underserved groups about which diagnoses they may or may not be interested in getting evaluated, and then they may or may not see as a clinical problem, a syndrome based off of cultural factors.
Hmm. Yeah, I've heard someone say that Black women have been depressed for 300 years. We just don't have time to realize it.
Right, right. It's like there's when you're in survival, you don't have time to really,
Right,
okay, now I got to take out another hour out of my week or an hour every 2 weeks to go see someone when I got so many other things that I'm juggling.
right, right. Yeah, I think there was one very successful charter school in New York, Harlem. I think Malcolm Gladwell wrote about this group of minority students, mostly African Americans in Harlem, and they were outscoring private schools within a certain area in New York. And he didn't understand why. One of the things that stood out to me when I read the book Outliers was that they had medical facilities set up on the same block. So when parents would get off work, they could take the children to the doctor or to the clinic, or they could go themselves. So it's very hard to try to work, get off work, go to your doctor's appointments, whether it's your mammogram, just if you have a persistent cough. Sometimes we as adults, and especially when we're parents, we ignore those things and, and just, go through the day to day grind and get your children, you go home and cook, and you get locked into these routines without taking care of yourself. But one of the reasons they felt like this school was so successful was because there was a higher rate of doctor's visits for the parents and the children.
Yeah. Yeah. It's interesting when you think about like accessibility, you can see that, right? If you think about like if any of us or the audience can think about, okay, how hard is it to get a parent that I know or a friend of mine to go to the doctor? And you can probably immediately think of someone or several people who like will wait till they are on their last leg to go to the doctor. And the same thing across mental health and other services. And most of the time, people don't want to take that time, or it's more inconvenient to take the time to go see someone for both physical health and mental health problems. And so I think that really speaks to how underutilized these services are. There's so many accessibility problems, and what that school did is, okay, we're going to put this right where you already are, right? And that's why
Right.
we see some. That's why you see benefits with like school-based health, right? School-based health, school-based behavioral health are so heavily utilized because those kids are in the school already. Why not have a clinic in the school?
Mm-hmm. Mm-hmm.
And same thing with behavioral health. The kids are in the school, so having psychologists available to those children increases the utilization exponentially. Where if you're in a standalone clinic, there comes a whole lot of other accessibility issues that both are covert and are very obvious that you can mitigate by just having a clinic incorporated into a school, right? Um,
Right.
and to
And,
make more, sorry, go ahead.
no, I was going to say, and that will lead into your research while you were working on your PhD, where you specialized in telehealth um, practices in rural and underserved areas. But we can talk about that later because I really want you to expand on the fact that we now have access to that, mostly everybody in America, because of technology, which is a great thing. But are we taking advantage of it? But also would like to touch, and Princess and David, and I don't know if Tim's on, could also touch on some of the uh, things happening with some of the athletes who are suffering from depression and high rates of suicide, based on, different hits. I don't know all the background knowledge. If one of you could contribute some information about that, or Darrioun, Dr. Webb, if you know
Sorry.
anything.
Oh,
Hmm.
yeah, oh, okay. I thought Tim was going to jump in. If he could kind of touch the bases up on kind of like the CTE, which most athletes have are
Yeah.
getting.
Touch bases
And
on
what is
what? Sorry.
CTE?
Oh, CTE. Like, I don't know why I can't think of it. Well, the actual acronym, real quick. Chronic traumatic encephalopathy.
Yes.
Um, and so neuro is not my specialty. There's just a lot to memorize and a lot of structures and a lot of interplay across these structures. But CTE is like the result of just chronically suffering traumatic injury, right, to the brain. This is something I think is vitally important and unfortunately misunderstood by the general public. That like it's a traumatic brain injury isn't hard to suffer. Like the brain's not designed to rattle around in our skull, so it
Mhm.
doesn't take much pressure to experience a traumatic brain injury. And so with like when that's happened chronically, you start to see the degenerative changes in the brain that can impact personality, behavioral and cognitive decline, So it's very important to be mindful of like what are you doing in your day to day life, and how often are you doing anything that shakes your brain around? Because I mean that's significant. We want to be very careful with how we take care of our brain.
So all states now have a helmet rule. Is that correct?
Yeah, Von, that's become a really big issue, not only at the professional level, but at all levels of football now. It was something that Doug and we tease each other about sometime on the program, that when we played, it was pretty common to get concussions. We probably all of us did, and continued to play to at some level, unless it was just really really severe. I mean, they
Wow.
would come over and ask you how many fingers you were holding up, and if you guessed right, they would wave some smelling salt under your nose until you get back in
Yeah.
there.
There you go.
Oh my God.
Yeah,
Whoa.
yeah, it was. That's no exaggeration either. But
Like you said, Tim, too. The most the crucial thing they used to say, "Hey, come on now, shake it off."
yeah,
Oh,
yeah, that's right. That's right. And
really?
Yeah.
yeah, it was very common. And I don't even could pretend to have an idea as to how many concussions I probably had. Now that I think back on it, I wasn't thinking about it then because you just wanted to play. But I think Duck and I both have read about or known professional ball players in particular that have suffered from CTE very severely. I think Dave Duerson committed suicide from the Chicago Bears, as well as uh, Junior Seau.
Andre and Andre Waters.
Yeah, Andre Waters as well. So there have been several ball players who have suffered so badly with it that they just committed suicide
Hmm.
because they couldn't get rid of the ringing in their head
Hmm.
from all those collisions of years of playing ball. And then I know of a couple of other friends of mine. I won't mention their names, but a couple of guys that played that show some signs of it, but they have not been successful in terms of getting the diagnosis that will allow the NFL to compensate them
Hmm.
for that. But that's a very common thing, particularly with football players.
So the NFL is compensating.
They are, but they're making it
No,
very difficult.
yeah. After you die.
Wow.
Wow.
Yeah, I have, not mentioning names, I know someone who's had someone very close to them who committed suicide as a teenager, had been an athlete since 5 6 years old, as we a lot of you all started playing little league and Bluefields Stadium. And when the doctor examined the brain, a special doctor said that 15-year-old's brain looked like the brain of a boxer who was 30 years old.
Mm,
Well,
mm.
Yeah,
I
I
mean,
don't doubt it, and I think some of the groundbreaking research that has been done on CTE was done at West Virginia University. There was an African doctor or researcher who did some really groundbreaking research up at West Virginia University Medical Center
Very
that
good.
had not been done by any other medical center in the country.
well,
That's
yeah.
powerful.
Yeah, it is. I mean, if you think about CTEs, and if you think about just the brevity of what that might look like functionally for someone, I mean, that's big stuff uh, to be mindful of and to treat and manage. You know, you've got again, you've like what was said, you've got people who might die by suicide as a result of some of the changes, both lifestyle and grieving a loss of a lot of functioning. That's one of the things that I think that um, may not always be at the forefront of people's minds when you think about athletics and injury. Right? Is that there's a lifestyle that's lost, and
Yeah.
the toll on that's a lot. You know, when you think about problems with planning, organizing, and problem solving, carrying out tasks, you've got deficits in that cognitive functioning. Your mood might be changing. There's this loss, and you do have a risk right there for suicide, which is something to be very careful of.
Yeah, I think with Darrioun, and with that, just talking about our youth again and all of the pressures they have from social media, how that's impacting anxiety and depression. Could you talk about some of that, please?
Yeah. So without having absolute numbers off the top of my head, and we know that there are indicators to suggest that things like social media have increased the prevalence of like anxiety and depression in youth. People, social media is a machine for social comparison. It's natural that we do this. So it's important to be mindful of how this is going to affect underdeveloped brains and naive minds too. It's when you're a teenager or a young adolescent, you are quite literally naive to the way the world works. So you see these things that people post on social media, how great everyone's lives is, without maybe appropriate consideration for the fact that people don't share the bad stuff. At least typically, there are some rare cases where people might post themselves crying and things like that, but you don't typically see the lemons of someone's life. You just see the lemonade. So a lot of children don't have that like reference for what they're engaging in, and they're comparing themselves to what they're seeing on social media, this unrealistic stuff. And that makes it very difficult to cope with the world, especially when you're at that age anyway. You're impressionable. You're developing into what everyone is trying to move you toward, which is like being an adult. And there's all this uncertainty, confusion. It's all developmentally appropriate, and then you add something like social media that makes it just difficult to understand like what's realistic, what is real, what's not. Um, and it's hard. It's a lot to handle. We
Hmm.
don't know how we haven't had enough research on the long term effects of social media use on the developing brain and incidences of like psychiatric disorders. Um, we have not had enough research into that compared to how accessible it is. So I think it's a major risk factor when you see increased rates of death by suicide by based off of social media use. And on top of opening up discrete avenues for things like bullying, cyberbullying is one of those factors contributing to this increase. And cyberbullying can be invisible because it's on your kid's phone. Not that regular bullying isn't invisible, but there's I think, a unique kind of bullying that comes along with anonymity. Through social media that is also a significant risk factor for both suicide and mood disorders and other psychiatric disorders.
So, Darrioun, let's go back to when you were in high school, and I know you earned some pretty big scholarships, and we know due to the administration that is in office now, a lot of things are changing when it comes to scholarship and going to college, scholarships and going to college. I think you earned a lot of your money from volunteering. Is that correct? And how far did that carry you? I think all of those type scholarships have gone away. And then after that, I would like to touch on telehealth in rural and underserved communities and how that is helping out a lot of people now.
Yeah. So, actually, the majority of the money came from the Promise Scholarship in
Hmm.
West Virginia, which I had to Google, and apparently it's closed. I think it may be. I don't know if it still exists. Um, I have not, of course, been keeping up with something like that in a while, but it looks like, yeah, Promise Scholarship still exists. Um, but that's where most of my money came from. With West Virginia, if you had, I believe, as long as you maintained a 3.0, you could keep you could keep your scholarship. Actually, I see here maintain a 2.75 cumulative GPA. Then they'll give you like, I don't know what the number is now, but for me it was like maybe 4,000, 5,000 a semester, something like that, which that's a large chunk of change for someone trying to go to university or college, if you're coming from an underserved group. Um, so it's interesting that we see all these efforts to kind of like get in the way of all these scholarships and grants when,
Hmm.
you know what benefit does it do us to make it harder for people to develop skills that they can give back to the community, right? By me earning scholarships, there is now a psychologist in a rural community. And so, you'd have to look at, okay, what's the value of that? What's the value of having this male psychologist, young black male psychologist in a rural community that otherwise wouldn't have been able to do it without assistance from some scholarships and grants, you know? So I can't wrap my head around trying to reduce access, right? By eliminating programs like this rather than let's increase access as much as we can.
Tell us about your telehealth research and some of the information that's very interesting about that now that we can be home and research and be served on a regular basis.
Okay, so when I was in my program, we had to do a doctorate research project. It's an alternative to a dissertation. The running joke among staff is like, no one reads the dissertations anyway. Like most of the time, your dissertation is only getting read by your panel and yourself. Maybe a family member is going to read it, and so they came up with they utilize this alternative, which is a doctorate research project, which goes through a lot of similar steps, but can kind of be focused on getting the experience of doing research. So for me, that project was on rural telehealth and access. A lot of it was to look at, okay, well, we have telehealth, right? Telehealth has been a model, an option for a long time. You know, you see the first, and I wish I could remember now as clearly as I did a few years ago, but you know, you see first incidents and examples of telehealth, and you know, maybe the some as like many things, military programs, right? Um,
Mm-hmm.
Sometime in the 1900s, right? But the technologies existed for a while, just never been heavily used until there's a major disruption in accessibility, like with COVID, right? So, what we know about telehealth is that it does increase access, but that's not all. Just because you have a telehealth option available doesn't mean it's going to get used. There's a lot of factors that also that influence accessibility beyond whether or not something exists. You know, whether or not there's a clinic that has behavioral health in a rural or underserved area, just because it exists doesn't mean it's going to be utilized. So what I learned a lot from that project is how to look at accessibility beyond whether or not something exists, but you know, what might be the attitudes of the community, how might the convenience or ease of use, the understanding of the tool, um, as well as do these tools have significant barriers that are accessible across demographic ranges, right? As When you get into your older population, they're going to really struggle with telehealth. You know, youth,
Mm-hmm.
youth are going to be all about it. Older folks are going to struggle. And how can you reduce those barriers for the population that struggles to use technology? And so telehealth is incredibly beneficial in increasing access. It's just there's more to it than having a telehealth option. You know, how's your software? How's your hardware? In rural communities in COVID, it's like, hey, here's telehealth and we're good looking from the outside. But when you live in the community, you also have to think about, okay, what about like broadband internet access? Because where I currently live, which is in Monroe County, West Virginia, um, they the access to high speed internet was severely limited until the year I moved here, which was 2023. And the only reason that changed, um, I'm reserving my opinions about Elon Musk here, but Starlink created a massive surge in accessibility for high speed internet. That like prior to that, you could get like 10 megabits per second, and that's nearly useless for video content.
Mm.
So,
Okay.
you know, during COVID, there's all this telehealth, but like if you live in a lot of these areas, you didn't have the technology, you didn't have the infrastructure to take advantage of it.
You know, it's very interesting. You mentioned that. There was another thing that I heard from several educators because the kids were not able to go to school during COVID. And a lot of them were sort of bemoaning the difficulty with doing remote classrooms in the public school systems in some areas because of that very issue of not having good broadband service in some areas. So they were trying to do, virtual classrooms with Zoom and other platforms, and it just wasn't working in some cases. And I think that there were even some school districts that funded the purchase of laptops, tablets, and some remote internet service to make sure that their kids were able to participate in the education during that period of time.
Yeah, and those are examples of like how you actually facilitate access, right? You don't just look at whether or not you have the opportunity, the availability of a service. You make sure that everyone has equitable access because there's young people who live in areas where there is those where there are those limitations. So making sure that you know if you're buying these tablets for the school children, that they're not going home and still can't use it because they don't have internet.
Yeah, and we gave Elon Musk credit, so let's also give our former President Biden with that infrastructure bill. That infrastructure bill made a big difference in a
Hmm.
lot of those communities that you're talking about.
Yeah, I mean there was a bill that I think that the Trump administration shot down or has ended the progress, which was for expanding broadband internet access in rural areas. Right, it
Yeah,
was
yeah,
part of some of the Biden administration's efforts, and I was really disappointed to see that happen because I was really kind of hoping for um, a more viable option so I can get away from Starlink because it's expensive, for the speed you get. But having that shut down now, in these rural areas, all you have is satellite internet.
Now, how do you reach the people that, like when you're talking about the internet with telehealth, that can't get on and can't get to you?
Hmm. In a lot of ways, you don't. That's the shameful part of it. Is like it's so easy, and at the same time, you can't if they don't have the infrastructure, right? If they don't have internet, then their only option would be to come in person. Um, and so, for using telehealth, people have to have the internet connection. Now, if they do have everything and reaching them is just a matter of like, okay, I need to inform people that this exists. They need to know that a service is available to them first. And then you also want to make sure that they have the capability of like conveniently using it, right? So say I'm offering someone telehealth, but they live in a house with a two bed, two bath home, and there's six people in it, and they don't have a private space to go, right? And so that kind of defeats the purpose of telehealth as a respect to like with respect to like behavioral health, because you can't engage in a confidential conversation when there's nowhere to go. And so it's things like that that are part of those invisible accessibility factors that there are models that make up for that, like these school-based clinics. I saw a patient from my clinic, or in my clinic, from the school-based clinic because his preference was to see me. And so, even though he was in the school-based clinic, he saw me, a non-school-based provider, because now he's got somewhere to go, right? He's got somewhere to perform the meeting, and there are different billing practices for it. So it made something that previously wasn't accessible for payment purposes and having the space. Now he's able to use telehealth to see me in my office in a way that is now paid for, and um, he doesn't have to worry about being able to either come in person or struggling with the confidentiality at home.
Wow. So you said a lot, and that is when Duck asked, "Well, how do they get it?" Well, they probably don't if they don't have the accessibility to Wi-Fi or broadband, as you said. And then there are those who are older who don't really even like their phones. So now you're telling them that they can talk to the doctor over broadband, and they say to you, I want to go in and see, look in his face and talk to him and have him. There are a lot of different, gosh, um, um, what is the word I'm looking, barriers to all of
Hmm.
this too. But when it works, I guess it works. And I like the fact that the young man wanted to see you, um, outside of the clinic at the school because of anonymity or at least privacy, but still get help. And that's the most important thing, is to get help.
Absolutely. And like you said, if we talk about our older folks, um, sometimes going to the doctor is one of your social interactions. And it feels good to
Hmm.
do that in person, to see someone. And so that does feel more isolating to have to then do it through the phone, because you don't get as much of that feedback from the experience. And so telehealth is also a limit. That's also a limitation for access to health. Telehealth for that demographic is that you might want to see someone in person, or you have just concerns about security.
Hmm.
If you're used to being on the internet and doing the like privacy agreements that no one reads anymore, and you've signed 2,000 privacy agreements for every service you've ever used on the internet, you don't think twice about it. But if you're not doing that a whole lot, you read these privacy agreements about what may or may not be shared and limitations. That can be frightening for someone, and so that also becomes a big barrier.
So, Darion, do you see what maybe we see in just normal healthcare, and that is that I have to, say to my husband, "You have a doctor's appointment coming up, and you're gonna keep it. We're not gonna come up with an excuse." In mental health, do you see more women than men? Because I'd love to go see someone. I talk to them all day. But most men are not talking about their problem, their troubles, or insecurities much at all. Maybe with the best friend.
Yeah, no, that's certainly the case. As you will see, utilization of behavioral health is higher on with women. Um, so that's one of the things that's unique about my experience in this clinic is that from the perspective of the director, she said that you kind of are tapping into this population that we aren't normally seeing, which is the early adult and late adolescent men that are coming to see you because they finally feel comfortable with being able to talk to someone. You often experience that dilemma for males that you don't want to be vulnerable with another woman because you are concerned about some kind of negative evaluation, where it is more comfortable and probably for some in-group biases to be able to open up with another man.
So Tim and Doug, is it considered maybe weak to say, okay, I have a problem, where to show vulnerability? Um, do How do you get through that stigma, Tim or Doug?
I think it is. There is a stigma for sure. Some of it I think is cultural, some of it historical, related to the culture. Because I think our generation, it's not something you hear very many people talk about.
Mm-hmm.
I
Tough it
think
up.
as
Put some
yeah,
dirt.
as we
You
yeah,
know.
yeah. I mean, you'd hear about people who had therapy, and it was sort of hush hush in the community, but the whisper was, they're a little bit nuts.
Yeah.
Um,
Yeah.
so but nowadays, I think as we have progressed, and society has been more positive about doing that kind of thing. I do know a few men, black men, friends of mine actually, who have gone to therapy and have said it's done really good things for them. But there has been a cultural stigma, I think, for most of my life, because I didn't hear people just openly talk about that until just a few years ago.
Mm-hmm.
And you're absolutely correct, Tim, because I know growing up that was the furthest thing from your mind. The first thing they say, you talk about doing something like that, they say, "Oh, this joker crazy." So
Exactly. Yeah.
yeah, so you try to stay away from that. But I know by learning and researching and I think we're growing I know my age group, we're grown to the point that, hey, we feel something's wrong, we would even recommend it for somebody else.
Yeah, yeah. Because I fortunate, and I'll be a little bit transparent here. I've had a family member who's had some psychological issues to deal with that were fairly severe at one point, and have been lessened over the past probably 15 years or so. But it becomes the kind of thing where now you look, when you see signs, you see people who are concerned about stuff like that. You'll even recommend that a loved one go and get there.
Yeah, Darrioun, and what are some signs? And I'm being kind of silly here because I have opened up the refrigerator to use the microwave, and then I wonder, oh my gosh, is something going on? But um, do you have people to say, my husband's a little bit off, or my wife is a little bit off, and they're forgetful? Do people approach you with any of that?
Yeah, people. It's memory is one of the things that I think is very commonly brought to my attention. People are often concerned about their memory, and one of the things that's complicated about it is there's so many things that can impact our memory, attention, and concentration. Um,
Mhm.
and so people will often bring that up and say, I just don't think I remember stuff as well as I used to, um, and some of that's probably normal, you know, that because if you think about being younger, right, there was a lot less information competing for your for storage there. As you age, there's just a lot more information, a lot more experience, a lot more to sift through. And I understand the concern because like memory and concentration concerns are linked to a lot of pretty significant disorders and diagnoses that people want to be mindful of, things like neurocognitive disorders like Alzheimer's or Parkinson's. And so you want to be very mindful of it. And at the same time, what you just want, it's relatively straightforward to go to a, a professional and get a screening done. They're relatively simple. It doesn't take a long time to get some neurocognitive screening. And so I just, hey, do that. Again, it comes up a lot. People will say, I think so and so's memory is fading. In those cases, I'll just say, hey, I encourage you to talk to them about it and get them to seek some screening if they're really concerned. And then when patients that I see directly are concerned about it, we talk about it and we can do a screening if they're really concerned just to see if there's anything abnormal.
So, Darion, is mental health issues hereditary? Have you seen it where it's passed down from generation to generation, where someone in each generation has it, or there's several in one generation?
Yeah, that's some of it brings into the like arguments of nature versus nurture. Some things are socially learned. Like if you think about anxiety, if I've got an anxious parent, I may likely develop into an anxious adult myself.
Mm.
Because I'm observing this parent be very hyper vigilant, be worried about all kinds of things, on edge. I'm going to learn to navigate the world in a similar way, as well as like there are genetic components that also facilitate the development of these things for I want to say of a majority of psychiatric disorders do have a heritability, right? Whether or not, again, it's nature or nurture, would involve some investigation into individual diagnoses. But yes, there is a likelihood if a parent has a problem, then a child may inherit that.
Well, Dr. Tim?
And
You
yeah,
know,
my thing is, and I hear what you say, Dr. Webb, about that. We were always kind of brought up to that thing, anything like that, you would try to break the chain.
yeah, yeah,
Hmm.
Yeah, yeah. Um, and in my community in the country where I was brought up, yeah, she's touch. Okay, what
right.
does that really mean? But I've
Yeah.
heard that so much, and it didn't dawn on me until an adult. Okay, maybe I'm understanding some of that now. Um, Darren, I just want to be transparent. I have actually sought out to see someone because I arrange the same thing on my desk 30 times. If I'm sitting and
Mm.
watching TV, I'll rearrange the remote for the fan, the remote for the TV, and whatever phone. I'll sit just unknowingly. I've done it 15 times.
Mm-hmm. Mm-hmm.
So,
And was there more to that? Sorry, I started talking already.
no, no, go ahead. Go ahead. I
Yeah.
thought Duck was ready to chime in.
No,
Oh,
yeah, but I will after he.
Yeah,
yeah.
okay.
When you notice those things about yourself, you always get an opinion because some of these things show up in really sneaky ways. Um, and so you could be experiencing some anxiety, OCD, memory related problems. There's a lot of overlap with these things, right? That's why the differential diagnosis is such a valuable skill for the individual clinician because you're going to see a lot of variance there and how well they do to diagnose and differentiate across all of these problems because of the overlap. So I always will encourage someone if they're noticing something unusual, you might as well ask about it just to see if there's anything going on.
Oh, yeah. I can't stand for something to be out of symmetry. But, Duck, what were
Yeah.
you going to say? I can't.
Yeah, can we? I want to go back with Dr. Webb to you, Princess, about the refrigerator and the microwave. How can Dr. Webb? How can we help her? I mean, that.
You knew it was coming, didn't you,
Oh,
Tim? Tim, you knew
yeah,
it was coming.
she might,
I
she
knew
might,
he wasn't gonna let that go.
yeah, she might need some big labels. That barbecue might help.
Hey, Rev has promised to take care of me. That's all he said. He said, "What are you doing?" I said, "I'm going to use the microwave." Okay, that's not it. That's not it. I knew Duck was going to do that to me. But
Yeah,
um,
yeah,
you
Dr.
both
Webb.
got. Go
Can
ahead.
I can I can I ask you sort of a general question? I think I asked Patrice this several years ago. She was on my podcast, and it was back during COVID, and it was but it was new then. It was only a few months in, and the numbers were rising, and we were still in shutdown, and before. Yeah, I think that thing lasted almost 2 years or so before it really started to break, and people started to feel comfortable going out and doing things again. But my question was, human beings are generally pretty social beings. And I think we had, prior to COVID, sort of assumed that working at home, um, being a technological society was something that would be more productive to us as a people. Uh, what did you see in terms of people's negative reactions to being isolated like that for as long as we were during that period of time? Or did you see it?
Yeah, I mean, the evidence suggests that there have been some significant increases in anxiety and depression. And being isolated like that, it makes a lot of sense. Like you said, we are social creatures. And at the same time, there's a global threat that you can't see. It makes a lot of sense to be increasingly anxious too. And so we have seen evidence for that mood and anxiety related problems increasing significantly. And when I was practicing during that time, it was all telehealth. And you do have some people who are just like deathly afraid of getting sick, having to isolate themselves from their family because they've got some family members who might not be taking it as seriously. And so it's like, I can't
Right.
be around these people because I have a significant health risk. And that also shapes the way you see people. It may change the way that you perceive people's willingness to like make a sacrifice for themselves so that others can be comfortable. And that's one
Right.
of the things that also was a pain point for me is to see all the resistance to wearing masks, so much resistance to social distancing, and all of these things that were really helpful interventions to get through COVID when it really does test your ability to put other people's needs first. And then there's also the impacts of developmentally when a group of people are isolated from this what is normal social interaction. How does it affect them as a group? And there are conversations about sort of the generation of youth that were in high school and even late middle school during this time, the impacts on their social development, because those are like pivotal times. You go out to a dance and get rejected or something. You're supposed to have that happen, but you don't get that chance during COVID. Or, you're losing out on prom, other senior week celebrations, athletics. We've been
Right.
talking about an audience of people who are in athletics and just not getting able to play sports for years. That has a significant impact on mood, esteem, and sort of your broader outlook on life. So there are, I think, so many ways that being isolated during COVID had negative impacts on people.
Mhm. Speaking of
especially,
which,
especially.
go ahead, Doc. Go
No,
ahead, Doc.
I'm just saying, especially when you get turned down going to the prom. But go ahead. I'm sorry, Tim.
Yeah, yeah, I caught that one too. But I would, and that's exactly where I was going to go. Since you mentioned it, in terms of just personal, how do I say this without sounding uh, crass? Intimate kind of relationships that people were missing during that period of time. If you're not married, you're not in the same household with the person that you might be intimately involved with in a romantic kind of way. I'm sure there have been some conversations that you had with patients about frustrations in that area, particularly during the COVID shutdown.
Yeah, I mean,
Hell or hell.
there's probably like I believe there's some evidence to suggest that COVID negatively impacted those things as well. There were, like you said, you're not able to go out on into these social environments where people are doing dating. They are, and they're even hooking up and things like that, and that's just gone, right? And that's a lot of practice. It's a lot of experience that you don't get to have during that moment. And then you might feel delayed. I know that there are, and when we talk about like loneliness, there have been data to suggest that people are engaging in like sexual relationships at later points in their lives, dating at later points in their lives, whether it's COVID or just generally loneliness and technology, social media. All of these things are likely impacting that. But you're right; those are pivotal developmental experiences that were either limited or completely erased for a
Hmm.
period of time.
Yeah.
Darrioun, since Tim brought that up, on the opposite side, because a lot of married couples were forced to be in the same space where there are more pregnancies the year after. I'm definitely going to look that one up. Were there more babies born the next year on the other
Mm-hmm,
side?
mm-hmm. Yeah, it's an
Yeah.
interesting question because I'm sure there are some relationships that benefited from it, from being able to be together more. I enjoyed COVID because for me, I didn't have to go anywhere. My partner, she was more available because school was happening virtually. So we got more time together. That was really nice.
Hmm.
So there are some people who likely benefited as well.
I benefited from COVID because a lot of my clients were online anyway, and I gathered more clients, because that was it, is online presence and Zoom and all of that came out to be more comfortable with people to have those type of meetings, and not meet them at Starbucks or Panera. So I benefited from COVID for sure.
Yeah.
Any
And
last?
the
Go ahead.
and the idea that familiarity breeds contempt probably reared its head as well, and that may have been a good thing, though, for people to realize they were not compatible with this person that they were stuck with 24/7. They probably
Yeah.
couldn't wait for COVID to be over and to say, go out.
Hmm,
I'm
hmm.
not
So
touching
you
that
you learn a lot about people when you're in close proximity like that.
one. Yeah, yeah. We're gonna have to leave it right there. Duck and Tim, any last words? Or Darion, any last words from you before we reset for another show?
No,
No,
I
I'm gonna
just
call it.
appreciate.
I'm gonna call him after the show. We got to find out about you, Princess. I'm serious.
No, I
Okay,
appreciate the discussion. This has been fascinating.
fascinating for sure. Fascinating.
Yeah, I
Thank you.
enjoyed the opportunity. Thank you. And for the audience, don't be ashamed of mental health. I myself am seeing an individual therapist right now. So anyone can benefit from having that, at the very least, to have a conversation with someone on the outside, hear their perspective, and have someone kind of challenge your thinking. That is a beautiful consequence of participating in individual therapy. So don't let the stigma scare you away from learning to open up about some things that we all like to keep in our closet, a lot of skeletons, and
Yeah.
sometimes it's not healthy for us.
Amen. Amen. Thank you, Dr.
You're welcome.
Webb. Appreciate you being on.
I appreciate you inviting me.
All right, all right. So never had it so good. Thank you, Vaughn, for putting this together. Thank you, Dr. Webb. Tim and Duck, we're going to reset and get ready for our men's basketball discussion and talk New York Knicks. Never
Yeah,
had it so good.
I'm, I'm gonna call my therapist in between the show.
Yeah.
Good.
Well,
All right.
you're going to find one for me, so we'll do it. All right. Thank you, Dr. Webb. Never had it
All
so good.
right.
Radio.
All right.